Good morning all. I am Dr. Diksha Shetty, reader in the Department of Public Health Dentistry. Today I will be taking a session on Introduction to Indices. By the end of the session, you will learn definition of an index, ideal requirements of an index and classification of index. Index, as defined by Russell al., is a numerical value describing the relative status of a population on a graduated scale with definite upper and lower limits, which is designed to permit and facilitate comparison with other populations classified by the same criteria and methods. Let's now understand the ideal requirements of an index. The first property is clarity, simplicity, objectivity. Index should be easy to remember, the rules should be clear, index recording should be simple and easy to apply, criteria should be objective and unambiguous. Second, validity. Index should measure what is supposed to measure, that is, it should correspond to the clinical stages of disease under study. Third property is reliability. Reliability is synonymous to reproducibility. There are two types of reliability. One is intra-examiner, the other one is the inter-examiner. For intra-examiner reliability, one clinician examines same case twice. For example, morning 9 a.m. and evening 4 p.m. The results obtained should be same. Inter-examiner reliability. Over here, two different examiners should get the same result in a particular patient. Quantifiability is a property where oral health status is expressed in numbers that corresponds to a relative position on a scale from 0 to upper limit. That is, we have to be able to express the values in numbers. Example, in DMFT index, the number of decayed teeth are 2 or filled teeth are 4. Next property, sensitivity. Property which shows small shifts in either direction. Example, incipient caries from normal tooth. Next, acceptability means procedure should not be painful or demeaning to the subjects. Next, coming to the classification of index. Based upon the direction in which the scores fluctuate, they can be classified as irreversible or reversible index. Irreversible index, example DMFT. That is, once a tooth is decayed, it cannot be sound again. Next, reversible index, low and stillness index or gingival index. That is, once scaling is done, inflammation reduces and it can be restored to health. Based on the extent of involvement of the oral cavity, either it could be full mouth index or simplified index. In full mouth index, all teeth are involved. Example, Russell's periodontal index. Next, simplified index, example is oral hygiene index simplified, where only selected teeth called as index teeth are examined. According to general category or entity which they measure, they can be classified as disease, symptom or treatment index. D component of DMFT is an example for disease index. Gingival or sulcular bleeding is a symptom index. The filled component or DMFT or the F component of DMFT is a treatment index. According to special categories, index can be classified as simple index, measures presence or absence of a condition. Example, stillness and low plaque index or cumulative index. All evidence of a condition past and present is recorded over here. Example, DMFT for dental caries, which gives a lifetime caries experience. Here the session ends. These are my references. Thank you.